Welcome to the Plant Medicine Summit, where we're exploring the future of botanical medicine. I'm your host, Kelsey Barrett, and I'm here with Dr. Nashalla Nyinda. Welcome, Nashalla.
Thank you.
Nashalla began her Tibetan medicine studies in 1999 and is among a small handful of fully trained Westerners with the title of Mempa, Doctor of Tibetan Medicine. She teaches Tibetan medicine, meditation, the Soa birthing method, and Asian healing worldwide. Is an adjunct professor at Naropa University while maintaining a clinic in Boulder, Colorado. Nashalla, that's quite a honor to have you on here with everything you've done and how you're bringing Tibetan medicine to the West. And I'm really curious, what differentiates Tibetan medicine from Western herbalism or a traditional plant folklore tradition?
So firstly, I'll just give a little history. So Tibetan medicine can be traced back about as far as 2,500 years prior, before Buddhism even made its way into Tibet in the late 7th century. So animistic and shamanistic practices under what was known as the Bön tradition held a very deep understanding of nature and how the outer cosmos affects our own inner cosmos. And then that interdependence of this inner and outer becomes very reflected within the Buddhist principles, which later informed the classical text that now remains unchanged since the 8th century. So one very different aspect is that in the Tibetan healing system, we're 100% an individuated system, meaning each human body is comprised of a unique set of characteristics. We are all comprised of the 5 elements, but how they kind of line up is unique. So this combines with the understanding of how our cycles of life, our seasons, and our elements, the plants and the substances that we consume, how they work on the body via their respective 6 tastes and their 3 post-digestive actions and tastes, means that we can teach a patient not only like who you are elementally, but how to develop a self-awareness around the 5 elements in foods and medicines that you make or consume. So this means everything that we do herbally, we remain very steadfast in understanding first that there's a taste, there's a post-digestive taste. And essentially this means when a taste is consumed upon the tongue, it is going to interact with the elements and the powers within the stomach and the small intestine, and then also the powers of the enzymes that come from the liver and the gallbladder. So this understanding of how these 6 tastes are derived from a combination of 2 elements each, this means that these 6 become 3 post-digestively. And this is something which is a foundational point to how we compose formulas. And Western science only in 2007 discovered 2 sweet sensing proteins, which are expressed in specialized taste cells of the gut. And they sense glucose within the intestine, so the sweet taste. So I would assert that it's just a matter of time before science discovers that Tibetan medical theory is actually correct and how there's more than 5 tastes. So this becomes really important when we consider compounding herbal formulas, and something that I find is often overlooked in Western herbalism. And now the propensity these days is we just take all these herbs that have some kind of effect upon the body system and we just throw them together like, oh, this is good for like all of that, right? But when I look at my patients' herbal formulas or their teas that they're coming in and showing me, this concept of how there's this nature of hot and cold, these 6 tastes, and how they act upon what we call your 3 basic energetic systems is very different. So we know the 3 systems as lung or wind, or tipa and bile, and pagan, which is sort of translated either as earth and water or sometimes called phlegm. And this is largely ignored. So these 3 primary energies or natures relate very much to the Greek 3 humors or the dosic system that many have heard of in Ayurveda. So these ancient systems shared this Silk Road, and knowledge was passed and shared from as far west as Greece through the Middle East to like southern Russia and Mongolia, and then in throughout Southeast Asia. So the traditional Tibetan medicine text became synthesized in the 8th century following the first known worldwide medical conference, and it remains as an unbroken lineage, which if you compare this to Eastern European like folk and herbal knowledge, which was greatly diminished by Christian domination and colonialism, where a lot of traditional knowledge was labeled witchcraft or it was made illegal. And in fact, even Ayurveda was illegal under some periods during the British rule. But because Tibet was a civilization that was mostly geographically isolated, they were very selective in choosing what they let integrate into their culture. So the very fact that the 5 elements in the 6 Th, which I will teach you today, is fundamental in this 2,500 years of connection to an ancient way of harmonizing with the earth. We just really look at formulas and our compounds about how do we attune to the elemental based on physical disharmony in the body. And this pharmacological tradition remains very strong today. For example, in the coolest of the autumn moon, typically sometime between like October, November, when there's something in the sky known as the Rishi stars aligning perfectly, we take a purified calcite powder and we say our mantras while we're blending this calcite and mixing it, and we're collecting the moonlight and this cool energy, this heavy, blunt autumn energy, which is descending down. Like Chinese medicine says this too, it's descending down during autumn. And this has the power to cut fire diseases, which like acid reflux, which is coming up with that heat. And so like this ingredient is like a cornerstone for when excess fire is internally in the stomach, the liver, the small intestine. And in this way, we work in every aspect of nature as we make a formula.
Wow, that's so fascinating. And I mean, from a layperson, it could just seem very magical. And I hear, because you're combining all of the elements with the season, with the constitution of the body, with pathology. And it sounds so intact, which is very unusual. So I'm really curious, and I know our listeners will be curious about the 6 tastes, what those are. And maybe you could give us just a brief explanation of what traditional Tibetan medicine pharmacy training looks like to be prepared to, comprehend these complex systems between the body and nature.
Totally. So this is also a really great place to explain the rules of the 5 elements and the 6 tastes. So I'll kind of give a whole overview. So Tibetan doctors all train for about 5 years, and then they complete a 1-year internship. So throughout one's training, we all learn the substances in the world are all medicine. So even if poisonous, they can undergo a purification process. So this means every year we go to the mountains and we learn to collect throughout these 5 years how to process. So just as I described with this calcite collecting the moonlight and undergoing a long purification and preparation, in the same way, we learn about our compounds. Like, do we wash them in the cool mountain water and then place them in the shade to kind of increase the cold? Or do we take these pungent, hot and sour herbs and place them in direct sunlight to increase their heat? So this is like a basic aspect which Western herbalists can totally employ to capture or enhance this power of heat and colds. But we also have to know soil conditions, such as, does this grow on the sunny side or the shady side? This tells us about heat and cold. And like, for example, local mountain herbs, which I bring down to my boulder garden, are sometimes like 2,000 to 3,000 feet lower in elevation. The soil and the moisture conditions can change the taste composition. So we use the tongue. The tongue is a barometer for how much moisture, how much dry. How does this alter the sweet, the sour, the salty, the bitter, the hot, and the astringent? And I'll get into those tastes a little later. We have to know how to batch adjust due to like seasonal rainfall, specific crops. So if you really want to train in pharmacy, you're essentially becoming an alchemist. So like you typically either enter into your internship directly into pharmacy, or you come back after your internship in the clinic and spend another 1 to 4 years post internship perfecting your craft. And they have to know these 6 tastes and how they vary. So let me give some content and some examples as to how we work with the 6 tastes and the 5 elements. And the most important thing to understand is we're cultivating the skill of matching what's known as opposing antidoting temperatures and characteristics or qualities of the disease state. So you have to teach your patient, or you develop self-awareness to look within and see, does my disease state match my basic nature of the individual? Now, covering basic nature is a whole course unto itself, but let's just borrow 2 key concepts. First, we've already talked about hot and cold. Second, there's understanding your natural disposition or your basic nature. Are you more likely to feel heavy in your body processes, more slow, more sticky, more mucousy, more heavy? Is your appetite low? Is it dull? Is there frequent bloating and belching or foggy cognitive focus? So these are examples of like a heavy, a cool-natured aspect of an excess or a greater propensity towards like earth and water. Opposite to this, does one feel very dry and light and parched? And this can, yes, be heat drying the body fluids, but it can also be an aspect of the wind. Wind can be a little bit more neutral, deciding to pair up with either the heat side or the cold side, depending. So for example, if you imagine yourself in a cold wind and dry, think of a winter wind coming in at you. And then likewise, imagine yourself in the middle of a summer desert wind. And they're both wind, but they kind of pair with the heat and the cold. So we're looking at how these 5 elements combine within an individual and how the disease either overlaps or increases and harms your basic homeostasis state. So bear in mind that each individual has their own expression of homeostasis. And so with these 2 key concepts that I've explained, we take the next step and we compose our herbal treatment by matching these factors to correct through taste and the elements. And I'll explain those elements in a moment. But what this literally means is, does a disorder which is currently expressing itself match your nature, or is it unmatching? So this is very primary to developing self-awareness of what one needs in a disease cycle, in an environment, in a season. My patients who live in Florida are very different than the ones that live in Arizona, even though they both live in hot climates. So without this proper diagnostic skill, it's said that you're like a physician that's trying to shoot an arrow blindfolded at a target. So sometimes in our Western thinking, we just shoot at the disease. Oh, this compound is anti this or anti that, but we're not thinking in terms of matching or unmatching. And for me, this is a critical flaw. So sometimes it's simple to just adjust to what season, what environment or stage of the disease one's in. And it's really important to integrate this aspect when we're using taste. And so let me give an example. Say there's a heat-based inflammatory disorder affecting someone who's already very typically hot and dry and irritable. You would naturally choose antidotes which are cool and smooth and light, very sweet, nutritious, even liquidy or sticky even, to promote harmony and balance. And you're going to want to ground that rising heat. So essentially what you're doing is you're calling on the earth and the water in however you're treating. So you're using herbs which are heavy in influencing and encouraging earth and water to increase in the body. However, if that person is having this same inflammatory disorder, but is typically of a basic nature, which is already heavily influenced by this earth and water, this disease state is showing really high heat and inflammation as the primary influence. This would indicate two things. One, this disease is less dangerous because it's non-matching. And secondly, it's really important not to overly cool down with heavy, smooth, sticky qualities. And instead, you think about the qualities coming from the tastes of substances, which are more light, more subtle, more cool. So we're not going to overpower the disorder so much by increasing this earth and water that we're actually creating a secondary disease. And unfortunately, I see this very often herbaling, this yo-yoing of overtreatment to not getting at the root of the disharmony. And one example I can give you is like with Lyme's disease. Initially, you have a super pro-inflammatory hot stage of the disease. Yet, when it becomes like chronic, it turns to a deep cold exhaustion where the kidneys and the adrenals are affected, and there's low-grade inflammation. There's a lot of fogginess, cognitively speaking. And so this is an example where you can still have inflammation, but the nature of the disease in this chronic state is now colder. So if the patient's nature is already cold, or they might have more wind in this system, which is very easily influenced in a chronic cold depletion, and you're using strong anti-heat squashing, anti-inflammatory herbal substances, you're using a lot of bitter, you're using a lot of cold, you're using a lot of rough, the whole system gets too cold, and then the disease can actually enter into the nervous system, and you start to see CNS and PNS symptoms. So it becomes really difficult to recover. And in this way, it's super vital to develop awareness around the stage and matching and unmatching. So that's why I take the time to explain this. And there are many ways that one can learn these aspects, but I want to get to the heart of it all. I want to get to the 6 tastes. So I have included extensive details in my bonus upgrade for listeners who want to see how that gets put together. But let's dig a little deeper into the basis and how we apply these 6 tastes to manage this heat and the cold and these characteristics. So it may sound complex, but I guarantee you 100%, I know from decades of teaching my patients that we can slow down, we can learn to observe nature's cycles and all she has to teach us. And most importantly, when we focus on our own inner relationship of the cosmos, our own elements, and we bring that to like how we're relating to the outer cosmos, our personal awareness of taste, the power of taste, our herbs and our food, it can really help hone us into what we need. We develop that intuition. So I promise you, we all have this knowledge within us. We're taught that if we can quiet, we can access it. But often in the Western controlled science, we give all of our faith. But we have to return to remembering that nature is science in its most pure form. And if you turn into that, the taste as the base thing that you use becomes sort of a stage in which you can blossom. So for me, this is the future of herbal medicine that I want to see. So it's teaching people that how based upon your own elements, you can self-regulate, no need for the doctor, and you can harmonize through whatever herbs and kitchen spices that you have in your cabinet and your garden. So let's cover these 6 tastes. So the first taste is the most sort of potent, sweet taste. It's comprised of earth plus water. So if you think about sweet taste, think things like cantaloupe. You can think about that earth and that water and how a cantaloupe is grown on the earth, right? Or, you can think about an apple, or you can think about even like chicken is considered sweet. Oat straw is sweet. So that's the first taste. And so it has a lot of power because earth and water are heavy, right? They're heavy and they're dull and they're stable. So the second taste is sour. And sour is comprised of fire plus earth. And the sour taste always increases that fire. So it increases and blazes heat. We use sour to burn away any excess phlegm, any cold disorders, any kind of excess earth and water. The salty taste is water plus fire. And that makes sense. Just think of the ocean, right? And then the bitter taste is water plus air. And, there's lots of examples of bitters, lots of digestive bitters. And the hot taste, sometimes translated in like Ayurveda as pungent or in Chinese medicine, is fire plus air. And so you think about how hot and heat rises, and think about flames dancing in the air. And then the least powerful taste is astringent, and that is earth plus air. So these six become the three. Basically, by sweet and salty remains sweet. So that's the first post-digestive taste. Sweet plus salty remains sweet. Sour remains sour. And then the last three, bitter, hot, and astringent, all become bitter. So an example would be looking at this taste, post-digestive taste, would be like juniper. Juniper is cooling because it's bitter. It has a post-digestive taste also of bitter. Yes, it has astringent, but astringent also becomes bitter post-digestively. And just imagine holding a juniper berry in your mouth. And so for this reason, we have to know these six tastes. So let me give some examples of herbs. So coriander is very sweet. It's classified in various texts, mostly with the dominance of a sweet taste. Sometimes it's sweet to hot, or sometimes it's hot and then sweet. And I really think these discrepancies can be considered by variations in soil, altitude, climate, growing conditions, because Tibet is geographically huge. But either way, the sweet taste is cooling by nature. And so sometimes I do see this spice listed as neutral in potency as well, but it's used to cure indigestion, increase the appetite, it alleviates thirst, right? Earth plus water, we're adding in that water back. It helps dual conditions of hot mixed with cold, which makes sense because it does have heat in it. And so it's an ideal herb to use sometimes when we're not sure, or the disease isn't matching. Where is the hot over the cool? Or likewise, an opposite example, but still sweet, is fennel. And fennel is considered warming. And its post-digestive taste is sweet, but its nature is warm. So therefore, this sweet taste increases digestive heat. It eases gas, intestinal spasms. It attacks unwanted bacteria of the digestive tract because it's hot. So those are some examples of sweet. So that fire and water coming together to form the sour taste, I have two examples for you. The first is barberry. So barberry is coming into its own in the Western herbal world. I've been watching it where people are like, barbitones. I'm like, yeah, we knew that. But this plant has many different parts. You can use every part of this plant. It's so beneficial. But if you taste the berry itself, it's an excellent example of just a pure sour, remaining sour in that post-digestive state. And this fruit will actually dry up like excess infected plasma disorders. It helps wind disorders. Sour is typically warming. We use this particular fruit rarely, but we use it in one special 3-compounded decoction to work against heat and fever that enters into the heart chamber. So I've used it a couple of times during COVID for people that had either reactions to that or a reaction to the vaccine. And so it's considered like a nectar, this particular formula. And then pomegranate is the other classical example of sour. A really good pomegranate is not bread to become sweet. It's actually sour. And we have over 70 formulas in our Materia Medica, probably more, that are all based on the ability as this chasing away this cold indigestion, giving power to restoring our digestive heat. Because it's so sour, it blazes the heat and it just cuts through that excess of earth and water. And for the salty taste, remember our ocean of fire plus water. The best example, of course, would be like a Himalayan black salt. It's very warm. It removes dual conditions of earth and water together, which makes sense, right? Because it increases your digestive heat. And it can really help relieve constipation, pacify bloating. Sometimes I'll tell people to just put a little bit of salt in their water if water feels too heavy to digest. And so this salty still does turn into a post-digestive taste of sweet. So it's very nourishing for the whole body when it's not in excess. An example of bitter, I already gave juniper. So that water plus air, making that bitter taste. Bitter has that bitter post-digestive taste. In the case of juniper, I explained how that astringent that is also within it still becomes bitter. And we use this for a lot of things with like gout, heat in the lungs, heat in the gallbladder, heat in the liver, menopause symptoms, UTIs, of course, but another example of a bitter, which is hot, would be something known as Hing or asafoetida, devil's tongue, very warm in nature, despite this bitter post-digestive taste. And it's especially good for stomach disorders. It's against wind. It's really good against anxiety, insomnia associated with the wind, or when the wind disturbs the heart. It can act like a cardiotonic. And then our least powerful of the 6 tastes is the astringent, and that's the earth plus the air. So my best example is one that I use a lot in a bath right now for my COVID long haulers, and this is Artemisia or wormwood. So it's best used externally most of the time because it can be quite toxic if it's taken too much internally. But this is a really good example how astringent is cooling in nature. And this is a herb with bitter and astringent qualities. Now, when you burn it in the case of moxa or metza, as we say in Tibetan medicine, you're actually bringing in heat. So that's a little bit different. But when we're using it, it's praised for stopping bleeding, healing wounds, reducing pain to ligaments and tendons. There's many different ways that we can learn how to apply these elements into forming tastes. And again, I could go on for weeks on this subject, but that's just like a basic kind of synopsis of really beginning to waken your tongue and begin to think like, how can I start to sense what this taste is and all the complexities of taste? Because you can have an herbal substance that might have like 4 or 5 different tastes, but then you have to think who's the dominant taste, who's kind of like the side partners. And so when we're learning pharmacy, that's what we're learning so that we can then apply that as a doctor.
It's completely fascinating. I mean, I'm familiar with flavor. I'm familiar with the tissue states, but when we really start getting into post-digestive tissue states and building formulas from that, it turns way more complex. And I'm just wondering, I have 2 questions maybe for the more advanced listeners and then for our just new beginner listeners here that are just getting this information for the first time. How do you see this integrating into Western herbalism, or how do Western herbalists begin to train themselves on these more like formulating from this more complex perspective? So you're not seeing all of these formulas come to you that are inappropriate. And then for our, just our baby beginners, like what are some of the go-to herbs you have for at home for formulation, or people might be able to find on their spice rack, begin to experiment with their constitution and balancing their constitution at home?
Mm-hmm. Well, I think the main thing that's lost in modern medicine is this understanding that we're not all a cookie cutter pathological result. So like when I teach anatomy and physiology, I'm like, this is what it says. And then you have to figure out who you really are. So I think that anyone, whether they're a beginner or an advanced herbal practitioner, or you're just looking for your own home healing, I think cultivating the reflections upon your environment is super key, because the more you do that, the more you start noticing what nature has to offer, and you gravitate naturally towards whatever is needed within your dominance. You start to have self-awareness of, I need more heat. I'm always cold. Or, wow, I really feel dry all the time. And then you can begin to kind of use that barometer of the tongue and cultivate that. So treating according to the season, the environment, and the cycle a person sits in, really, are probably the primary things that I would say to use to start to integrate this, so that you can meet anyone's state of health in a very targeted way. Medicine is not static. Nature is not static. So we shouldn't just give an herbal prescription and assume it's needed all the time. So for example, right now it's early autumn or late summer. And so right now, over the course of, the last like 2 weeks through another like week and a half, 2 weeks before frost starts coming in my neck of the woods, then I'm seeing all my patients who are more like chronically related to like IBD, IBS, Crohn's disease, anyone who's more inflamed, because we've just gone through this accumulation of the season of heat. So the heat has been driving itself into the body. So they might be on some herbal formulas that work really well all the time, and then they'll have a flare right now. So I might change that prescription based off of my observations of the outer cosmos. So any herbalist can begin to recognize, I used to go to San Francisco a lot, and I'd be like, okay, when does your damp thing stop? They're like, well, if you're in the East Bay versus the North or whatever, it either does or doesn't. So then understanding, how do you antidote that? Okay, so we have dampness, but it's warmer. So then maybe we don't need quite as much sharpness. So you start matching the environment to what you're seeing, and then you give short courses of formulas that are targeted and not sort of like for the long haul course. You kind of figure out where a patient's weak link is, weak season. For some people who have weak digestion, it's right in the middle of winter. So that's when you lay in the heat. And then if they have an inflammatory condition, most likely it's going to be better during that time. So again, this is all kind of explained a little bit more deeper in my bonus vibe, but as a whole, the more we start to tune in to what environment we're sitting in, and then you taste the herb and you sit with it and you ask yourself, is this sweet? Is this sour? Is this hot? Is this bitter? So you begin to kind of learn how that is. And then you think, this feels really smooth on my system. This feels like a little bit rough, and then those kind of qualities can be developed in your own kind of bag of tricks as an herbalist, but also just self-awareness. So that's really important.
Very elegant, the way that you're describing short courses of herbs that remain seasonally appropriate always.
Mm-hmm.
I was curious if you ever see, I hear you inviting our listeners to check in with their own taste. What feels right in their body? How do different flavors make them feel? Do you ever notice that someone who's really, let's just say that they have more earth and water, and then all they want is sweet, like to exacerbate the condition? People can certainly probably go in that direction, right? Where they
For sure. It goes one of two ways. So normally when someone comes in and I do a comprehensive thing, I also do diet and behavior. That's like a foundational principle to our treatments. Medicine is one leg of a stool, and you can't stand on one leg, but you can stand on diet and behavior alone. So that's the primary way I treat. But that's based off of taste too, you see. So it's very interconnected. But it goes one of two ways. Either you're craving everything you shouldn't, or you reject everything that you shouldn't. So either they're going down the diet list and they're like, oh, that's so weird. I hate everything you say to avoid. Or they're like, oh my God, I eat everything wrong. So it goes one of two ways. But the thing is developing one's own inner wisdom. And that comes from when you get a guidance from a qualified herbalist that has enough of a relationship with nature to kind of tell you where you need to go, right? Oh, you need more hot. Oh, you need more sour. Just let's minimize the sweet and the heavy for now. It's winter. It's kind of a heavy, cold, sweet time, you know? So then if somebody guides you to that, what happens is your patients start to like wake up. They start to realize like, oh, everything they tell me, like I notice when I take my ginger lemon tea that I feel better, that I digest better. My stools move better. I don't have mucus on them. And then they start to think, oh, what else could be? Oh, they told me also that I should eat with more like cumin and caraway. Oh, they told me I could make, you know, a cumin tea when I'm getting bloated. I'm going to do that. I'm going to add a little tiny, just a shake of salt to that, because that salt also seems to like help relieve that gastric distress. Oh, they told me that I should cook with more turmeric because it's anti-inflammatory. I notice when I eat it regularly, then I have less inflammation in the morning. I'm less stiff. So we develop kind of this awareness. And I think that it's our job as herbalists to really be guides. We're not really wanting to be in charge or need to be needed. We need to awaken other people to their inherent potential. And then, you know, you had asked me, what are some of the main things I keep around the house? It's all spices. Spices are medicines. So whether it's, you know, nutmeg because it's warm and oily and combats like wind and insomnia, with a little bit of ginger and a little bit of honey, or maybe you also have some inflammation. So you do a tiny little bit of turmeric and you have that in some kind of warm milk before bed. It can be oat milk, you know, oats are very calming to the nervous system as well. Wild milky oats, you know, it's a lot of spices. Or whether or not you have more adrenal fatigue, then I might suggest cardamom. I say cardamom is your new best friend. So you just wait. I guarantee you cardamom is going to come out in a few years as like the wonder drug, because it's very good at increasing circulation to the whole pelvis. So people who are trying to conceive and hold a well pregnancy, people who have cold hands and feet, people whose circulation gets really difficult in the winter. It increases digestive power, it increases your circulatory system, and it's very good for digestion. So cardamom is excellent. I use a lot of that. I keep saffron in the house because it is the superior medicine against any kind of lung disorders and heat in the lungs. So this has been used a lot. It cleans the blood. It's very cooling. It is good for the liver. You'll find it in every liver formula. I keep elderberry in the house, of course, because it's antiviral. But, you know, that sourness is very good. It kind of keeps the digestive heat strong, even though we're also using it as an antiviral, as a preventative right now, you know. So it's the spice cabinet. You can find everything that you need, really, if people just ate more spice and then use spice as little like herbal decoction teas. I'm a big fan of that.
So in food and then boiling the herbs into.
Yep. Making infusions, all those kinds of things.
Yeah. So loading up on herbs as much as possible. Nashalla, this is just so interesting and really important for the evolution of North American herbalism. So thank you so much for bringing this in, like offering this extra bonus material. I know I'm definitely going to be reading over it and bringing this into my practice. How can our listeners, learn more about your work and maybe how to see you one-on-one as a client? It sounds like the medicine and magic is through the direct relationship also with you as a practitioner and really understanding how you see the body with the environment. It's so unique and really needed right now. How can we stay in touch?
So I do a lot of teaching. I teach online a lot, and I have a lot of published work. So you can read some of that like on academia.com or ResearchGate. And I teach locally. I mean, right now with the pandemic still going on, I'm not like going and teaching a lot of different places in person, but in terms of wanting to see us, we have a clinic in Boulder, myself and my husband. He's also a traditional Tibetan doctor. So we have a pretty active clinic. It's really kind of important to see people in person because we read the pulse. So we have people that fly in from all over the world, and then we kind of establish care and then maybe just have a check-in once a year or twice a year, depending on what's going on and if it's something that's stable enough to treat from a distance. So people can certainly find us. We're very Googleable, if that's a word. Tibetan doctor, Boulder, Colorado. That's it. We're it. So it's Tibetan medicine and holistic healing is the name of our business. It's the Nyinda Clinic of Tibetan medicine and holistic healing. And we're found at www.holistic-health.org. And you can also follow us on Facebook. Just look for Tibetan medicine and holistic healing. And I put out a lot of like other people's herbal tidbits on that Facebook page because I think it's really important to support all of our local foragers and herbalists. But I also want to say that even though I can be a guide for people, it's really my passion that you learn how to guide yourself by knowing who you are. So just really beginning to play with the elements and the taste is really significant and will reap really great rewards.
Thank you so much, Nashalla. Thank you on behalf of myself and Shift and all of our listeners.
You're welcome. Thank you for having me.